initial CdLS stand for? CdLS stands for Cornelia de Lange syndrome. Today I'm going to tell you what Cornelia de Lange syndrome is, how it's diagnosed, how they resemble one another, and medical issues that stem from it. Cornelia de Lange syndrome is present from birth and originates from gene mutation that affects the protein development in chromosomes. From Medline Plus, mutation in the gene NIPDL makes up for 60% of those affected with CdLS. A way that we can diagnose children is through molecular testing. Molecular testing can be done during birth or during pregnancy at any time or after birth. What they do is they test the DNA strand to see if there is any gene mutation. If there is, the child has CdLS. Another way to test and diagnose for CdLS is through a criteria checklist. This criteria checklist includes different categories such as their growth, development, and their behavior, along with facial recognition. If the children fall within those categories, the children have CdLS. Now that I told you what CdLS is and how it's diagnosed, we're going to move on to facial and lack of communication skills. With a short upturned nose, thin downturned lips, short, low offset ears, and eyebrows that meet in the middle, many of children with CdLS resemble each other in such ways. Another way they resemble each other is they could possibly have webbing between the second and third toe, over excessive body hair, and they could have sternum deformalities. They also lack communication skills. It said that 96% of children with CdLS have a communication skill delay in some way. They suffer from articulation disorder. Articulation refers to the structures in the mouth either touching or articulating with one another. For instance, the way we say certain letters, like the letter M, how we close our lips. Children with CdLS have a really hard time doing that, and most of the time can't do it. Now that I've told you what CdLS is, how it's diagnosed, resemblance between facial features and lack of communication skills, let's talk about medical issues. Children with CdLS encompass many different medical issues that can be critical, and they range from mild to severe. One medical issue that they encounter could be gastroesophageal reflux disease, which is also known as GERD. What happens is the stomach leaks back up into the esophagus, which causes major heartburn. With this major heartburn, children with CdLS tend to not want to eat because it hurts, which in turn, this results in low weight. From Dr. Bonnie Lynch at the 2008 CdLS Foundation National Convention, she reported that 29% of the U.S. recipients that have CdLS have some kind of heart defect or problem. The same test was taken in Europe, and that test proved that 45% of those children have congenital heart problems. Another medical issue that stems from CdLS are kidney problems and problems in the urinary tract. 60% of children with CdLS suffer from self-inflicted wounds. At least once a month, these children cause bruising or bleeding to themselves. They harm themselves in some way. What they can do is it can take form of biting. For instance, if they do bite, they tend to bite down by their hands and their forearms more often. Another way that they cause self-inflicted wounds is through pinching, scratching, hitting, banging their head off of things, anything like that, maybe even pulling their hair. Today you learned about what CdLS is, how it's diagnosed, how they resemble one another through facial features and lack of communication skills, also medical issues that stem from it. What I want you to take away today is that children with CdLS require a lot of time, energy, love, attention, care, and patience. I'm going to hand out some pamphlets here to show you what children with CdLS look like, how they resemble one another. There is some more facts on here if you guys would like to read about it.